right. So here's the Garnett Health Plan.
All right.
Like everybody, I don't even know how to define pre-existing conditions, but however they define pre-existing conditions, take all those people, and the first thing is everybody with pre-existing conditions, they're all paid for, 100%, no problem.
Okay.
Okay. I'd be willing to pay taxes on that. That's me. I don't know how. I mean, the Republicans are obviously, oh, we're going to cover pre-existing conditions. I mean, this is universal.
Mm-hmm.
So I think everybody in Congress, everybody in Washington, pre-existing conditions, boom. Okay. So, but what needs to happen is
everything that they need is paid for.
Everything that they need is paid for. No problem. Everything.
I love that. Okay.
Yeah. No problem. Take them out of the insurance market.
Wonderful.
Because they're covered.
Mm-hmm.
Because I'm convinced, based on what I've studied, the reason the premiums rose the way they did is because they threw everybody in with the pre-existing conditions in, plus the individual mandate, and stuff went crazy.
Well, the individual mandate is something else, but yeah, they put the pre-existing conditions. That's what I believe that it ballooned it. Yep.
Mm-hmm. So when you do that, then now you and I who aren't sick all the time, it's again just to compare it to something like car insurance, it's like, okay, we have to pay for an insurance plan where people have accidents every day.
That's right.
Yeah, we can't have that. So we got to bracket it.
Because we're mandated to do that.
Yeah.
We must. If we have the privilege to drive, we're mandated to do the insurance.
Right.
That's a mandate. Okay.
Yep. Yeah. So that 100%, that's what I do. Okay. And I think that would be supremely cost effective. Looking at the numbers I've seen, it would cost a chunk of change, a few $1 billion a year. Few billion.
Oh, no. I don't believe that.
It's not even that high?
Why? Because I have pre-existing conditions. I'm going on that too.
Okay. Well,
example now, you've already taken half my family off with pre-existing conditions, and we get full health care like the president. I love that. Because he said I got some lung problems. Vicky had cancer before. Just got MS. I could just go on and on. We're already paid for it. That's golden.
Okay, so right. So all right. So however we would define that.
Yeah.
We bracket that off from people who don't have pre-existing conditions and get them out. That would be a great first step.
And I don't even pay any extra taxes. It's great.
Right. Well,
we still pay the same tax base though. That's the cool thing. So you're helping pay for mine while I'm paying for mine too. I like that.
Okay. So I'm cool with that. I'm very very compassionate. I want to help people with pre-existing conditions. If that's what you want to tax me for, I'm down with that.
Okay. Good.
And I've been down with that for a long time. Ever since Obamacare, the whole Obamacare thing was initially put out, because that was the big deal. We want to pay for people with pre-existing. Okay. Hey, cool. Hey, you want to tax me for people to take care of them? I'm down with that.
Yeah.
Do it. Tax me for that. I'm okay with that. Okay. So we moved that piece off. Then what I would like to see is people have the option of going into what I would call catastrophic health insurance. Mm-hmm. So in other words, that's the kind of health insurance that I want. So again, like I was saying before, if Jen or I got cancer or something happened to us where we got a catastrophic disease, we've been paying into this policy for so long, the insurance company could still make their money, right? Mm-hmm. But we're covered. Okay.
Yeah.
And then in
insurance, whenever you take a higher deductible on your collision, you get a lower rate, right?
Right.
Okay, I get you.
So if that's the thing is that goes for life insurance, health insurance, whatever else. If you're relatively healthy, like Jen and I are, the kids are, it's a pretty low risk for an insurance company to say, hey, yeah, we'll sign you up for a policy. You pay $100 a month. Mm-hmm. Most years we're going to make $1,200 a month off of you, plus the other 40,000, 50,000 people that are on this thing. We're going to make a bunch of money, and then the few 5-10% that we have to pay out for, hey, we're still good.
Yep. That's how insurance.
Right. That would be, yeah. So I would want a catastrophic health thing. I would also want a tax-free healthcare savings plan, no matter what. So if you're that might be something I might even be willing to mandate, to say that, hey, each individual, each family has to pay in a certain amount of money to a private healthcare savings plan.
Okay.
Might even willing to be mandate that. Okay. Say that, hey, this amount of your check goes into your health savings plan. When one of y'all has to go get a 6-month checkup, a physical, whatever, then you draw the money from that, and that's how you pay for that.
I don't have to because I'm in that other group, so I'm okay.
Okay, well, so you're in the pre-existing. If you're in the all bets are off then. But if you're us, you're healthy, whatever, you have to pay into and it doesn't go to the government. It's your own healthcare savings plan that you have.
For healthcare.
What's that?
You can only use it for healthcare.
Only use it for healthcare, right?
You can't borrow against it or anything like that. Use it for healthcare.
It has to go in there. Has to go in there. Maybe we could write some stuff in that, hey, after 30 years you paying into that. If there's, $200,000 in there, $300,000 in there, maybe, something could be done.
Sure.
Or whatever. You're not going to lose that money.
Mm-hmm.
So that would be helpful. Then and then after that, just everybody pay for your health care.
Mm-hmm.
Because if you've got all the pre-existing conditions taken care of, you've got the catastrophic, you've got the healthcare savings plan that pays for your regular doctor visits, maybe the meds you need. What else do you need?
Mm-hmm.
To me that seems like pretty much a done deal. Then everybody can still make their money. All these capitalist pigs that want to make money off people's health care can still make their money, because the reason I think it's important that happen is, again, take the vaccine for the coronavirus. What country do you think the vaccine for the coronavirus is going to come from? It's going to come from America, no question about it. Because what? Right. Because the vaccine for the coronavirus, whoever finds it, is going to make a boatload of money off of it.
Mm-hmm.
Just plain and simple. That's what drives R&D, money.
Yeah. Mm-hmm.
Okay. Now, and I will back off that and say, look, I don't think that everybody involved in healthcare is just money hungry and money grubbing. I think people, for the most part, I would hope, this is a hope. I have no evidence to back this up, but I would hope that pharmaceutical companies that are doing research and development for new vaccines, for research for cancer or whatever else, genuinely care about human life. I hope so. I hope that they're, if their only motive is to make money, that's terrible. That's awful. That's evil. And if that's your only motive, then
it's what about their shareholders?
Yeah.
Are their motives to make money, or are their motives to be, human life? What's their motives?
Hard to say. But the thing, but then, so probably bar none, my favorite economist is Thomas Sowell, and his famous line is, and if you don't know anything about Thomas Sowell, you should check out Thomas Sowell.
Thomas Sowell.
Okay, Thomas Sowell he's a black man, for one thing. Okay, he's an economist that happens to be black. South side of Chicago. No, that's not. He grew up in Harlem, actually. Another one of my favorite economists grew up on the south side. But Sowell says there's no solutions. There's only trade-offs. Okay, so if you don't have a profit motive in healthcare, what's the alternative? Right. So you have no profit motive in healthcare. Okay, what's that going to look like? Well, and that's where you can bring in the examples from other countries where they don't have a profit motive in healthcare.
They do.
They do have a profit motive?
Everybody in healthcare goes to work to make money. Everybody owns hospitals or owns doctors' offices, runs their own businesses. They all do it to make money. Unless it's like a nonprofit church-run hospital. They don't do it to make money, but they do it to break even. So they're gonna still charge for something because they don't, or maybe they're funded from individuals. I don't know what they're funded from, but every place is to make money.
Yeah, well, but the point is that in single payer systems where those providing healthcare are guaranteed, hey, you're going to make this amount of money for providing this care. The price is fixed.
Not always. Anyway, yeah, I'll go along with that. That's a simple way to look at it.
Okay, so yeah, and I think that's right. That's probably a simplistic way to look at it, but at the end of the day, that's what it is. The government is essentially in single payer systems. The government has gotten the entire nation together to negotiate against those who would make profit off of certain medical procedures, implements, devices, that sort of thing. Okay, so for instance, let's say somebody in the world invented a heart, a mechanical heart that could replace your heart, right? Because you got this medical device. Well, let's say the whole world banded together to tell the people who invented this thing, hey, that's great, you invented it, but we're not going to buy it from you at the price that it costs you to do the research and development or whatever else. We're going to buy it from you at this level. See, that's where the price fixing comes in. When you get that many people together, you start to fix prices, and then people go, I would love to invent a heart that could replace a human heart, but we just don't have the money or resources to do it. I'm going to go broke, and I'm going to be out on the street, in 6 months' time. So let's not do that. Let's go figure out how to invent seedless watermelons instead. So the prospect of people making money off of healthcare in some ways seems disgusting, but at the same time, what's the alternative? Like Sol says, there's no solutions, there's just trade-offs. So it's disgusting that people make money off people's health problems. Yeah, that's gross. We don't like that. But what's the alternative? Well, you're going to price fix. That's the only alternative I see.
When the insurance companies, and I don't want to pick on any one, but an insurance company is covering you. Normally, they have you in a group plan where you can only go to certain hospitals within the plan, certain doctors within the plan.
Right.
And the reason they do that is because they've already negotiated prices within that plan.
Right.
So they've price fixed what's in that.
Yep.
Isn't that the same thing as what you described with the government?
Yes. Yeah, 100%. And that's why I think that if we were to do a one payer system for the pre-existing condition thing, I think that's the major problem in United States healthcare. Get that over there. Hey, we're going to take care of you. America, we love you. We're going to pay our taxes for you guys that have pre-existing conditions. No problem. I wouldn't even give it a second thought.
I wasn't talking about that. I was talking about you as having your policy. You're going to have your policy.
No. But if the only thing the insurance companies are insuring you for is a catastrophic situation, then the price fixing thing goes out the window. There's no way to price fix that.
So how do you determine what a catastrophic situation is? Is it done by price?
Well, okay. So now you're getting down into the granular policy type. Okay, so how do you determine what a catastrophic situation is? Okay, so that would be difficult to determine, I think. Obviously, if somebody got cancer.
Well, let's say, some people's cancer isn't as bad as other people's. I'm not trying to belittle anything.
Right. So
I'll give you a procedure that costs more than $10,000. So I think my son's infusions cost about $6,000 a month. So he wouldn't be covered in the catastrophic. Well, he'd be on the other plan anyway because he's in the pre-existing condition thing.
Yeah.
Well, most of us would strive to be on that pre-existing condition thing. Well, I'll tell you what my okay. I lived in two systems that were really super good, and I lived in the Canadian system, and I actually got sick while I was up there, okay? Had my gallbladder.
Yep.
And of course, being the strong American that I am, I waited until the absolute last moment, until I was in so much pain that I could hardly walk across the street to the hospital, because the hospital was across the street from my apartment. I literally couldn't tie my shoes to walk across the street.
That's terrible.
And I got over there, and they looked at me and they said, "Wow, you need to be here, but we can't treat you at this hospital." They put me in an ambulance to another hospital, and I was in the hospital for a week before they could even do the surgery on me to stabilize me.
Okay.
Wow. I did it that bad, okay? I went that because I didn't know if it was America, who knows what it was going to cost me when I walked in those doors, right?
Yeah.
And I'm going to tell you, they took the best care of me. I didn't eat a hospital meal because they wouldn't allow me to eat. I ate and drank intravenously. I didn't, which is so weird because you don't even feel hungry, but
yeah.
Anyway, you still go to the washroom and everything. Anyway, it's weird. But I went for my surgery, and after my surgery, I asked, when can I get out of here? Because, I'm thinking in the back of my mind, this is costing me a fortune. Oh my gosh, what am I ever going to do?
Right.
And I've already been in there for a week. So they gave me some ground rules. They said, okay, we want to get you up and walking. Obviously, you have to be able to use the restroom. We want you to be able to they put me on an IV where I had it hanging on a thing on wheels so I could walk around a little bit. They said, you can walk a couple laps around the ward on your own, and, you're feeling comfortable, we'll get you out. So it took me a couple of days to recover. And then when it was time to go home, this is part of the story I want you to listen to.
Okay.
It comes in, and I said, well, how do I go home? She says, well, you got all your stuff here. We got your clothes here. It's in your closet and everything. Right. I said, so what do I do when I leave here? She says, well, she gave me a little clipboard for me to sign that I was done, right? I said, so where do I go from here? And she says, I said, do I go downstairs and see the administration? Got to go down to the cashier. What do I got to do? She looked me in the eye. You know what she said?
Yeah.
She said, do you have a ride home? I said, what do you mean? And I said, she goes, if you don't have a ride home, she says, we can call you a taxi to make sure you get home safe.
Sure. Yeah.
You know what that operation cost me in that week plus in?
Yeah.
I never even asked for 1 cent. Okay?
Yeah.
And I can tell you my taxes in Alberta were not any more than taxes here in the United States, maybe 1% more, something like that. And to have the treatment that I had there, and I was a resident there, but I wasn't a citizen, but I was a resident, so I paid into the system, paid my taxes, worked there. I'd been there for a few years, and I got that kind of treatment, and the system just flat works. And before that, I had the extra Blue Cross Blue Shield on it, but when I was actually in the hospital, I didn't have any extras on. So that was great, what you get from the government kind of thing, okay? And all I've ever heard is good things from that. I mean, It really is that easy and that good. And you know what? Everybody, pre-existing conditions, if I stubbed my toe, if I waited too long, and I even hurt myself, whatever it was, I could go in and they would take care of me.
Right. Well, okay. So, and that's fantastic that all worked out for you. And I could show you, I could link to you countless videos after countless videos of Canadians having nightmarish problems with the same situation you had. So again,
of them that had. So I'll give you that. I have another friend that she had a knee replaced, and she needed to get her other knee replaced, and she had to be on a waiting list for about 1.5 years to get her other knee replaced. So they do have those situations, and I was acutely ill, obviously, so they brought me right in. There was no waiting in aisle 6 or whatever. I was right in there. I mean, I rode the ambulance, the whole thing, and they took really, really good care of me, and that's what the norm is, okay? You may be able to find those, but I'll challenge you to this I don't think you need to go look for videos for Americans that have problems with the medical system. I think that if you walked out to your front porch and the first person that passes by and you ask them if they've ever had a bad experience with payments with medical insurance companies,
Sure.
they're going to give you a list.
Oh yeah. Oh yeah. No. Well,
Doesn't work.
Yeah. Well, and I think that's where you and I agree is, and I think this is very much a consensus in the United States is what we've got going on right now is screwed up, right? Yeah. And Obamacare, the Affordable Care Act didn't help.
It was, but at least they tried with a step.
They tried. Yeah. Well, and then you've got the Republican conspiracy theorists that come along and say, well, the Affordable Care Act was just the first step in trying to get us all to just throw our hands up and go, oh, let's just do a single payer system. And
I hope so.
Well, okay. So, well, no, I don't hope so. I don't think we need to go to a single payer system because again, I am, just on a broad fundamental level, I'm against price fixing, and that's essentially what a single payer system does. Is it price fixes? So that's going to kill your R&D. So again, Jeff, the coronavirus vaccine is going to come from the United States. If there's a cure for cancer, where's it going to come from? Not from Canada. It's going to come from the United States, et cetera, et cetera. Every innovative drug, every innovative medical device comes from the United States because we're a market system. Because why? Because people will pay for that. Because there's money in it. All right. So the profit motive, okay, again, going back to soul, disgusting. How can we get rid of it? If we get rid of the profit motive, what do we trade off for? Well, we trade off for less R&D. All right. So that's my.
Nobody else in the world doing R&D?
Nope. Not to the level we are. It's not even, Jeff, it's not even close. It's not even close. The United States, again, say what you will about big pharma, big whatever, blah, 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 blah. Down the line, okay, and the disgusting things they do, and they do some disgusting things, I agree, all right, that are motivated completely by greed. But what's the alternative to that? It's just you're just not going to have the kind of medical innovation that you have coming out of the United States. It's just not going to be there because people got to get paid. And so for you and I, for the average citizen, that would be the perfect scenario. Again, bracket off the pre-existing conditions. Let us buy. I mean, under Obamacare, it is literally, I say literally, it is written quite substantively in Obamacare that catastrophic health insurance plans are forbidden. Forbidden. You can't buy one. That would be the second thing.
You know why You know why they did that was because they didn't want insurance companies to make insurance plans that people would buy that would keep them from having to pay the mandate and at the same time not really insure them because the catastrophic part was something you would never reach.
Right. Well, I think you're probably right to say that the catastrophic, how are we going to define catastrophic? Well, I would put it at, let's put it at the poverty level. What's the poverty level? $14,000, $15,000?
I don't know.
It's called any medical bill above 15, above the poverty rate is catastrophic. Right. And that's what you're insuring for. Okay. God have mercy that Jen and I never have a, $15,000. But here's the thing. You want to talk about anecdotes? I'm going to put a chew to back in first, and I'll tell you about an anecdote.
Okay. Well, while you're putting that in, I'm going to give you what they do here.
Okay.
What my experience, I had insurance when I first came back from overseas. I worked for a company here for a couple of years where I had the insurance. And our deductible was $7,500 a year per person, which is not unusual in the United States at all.
Yep.
But the thing is the $7,500, when we did go to the doctor, it seemed like all it was is they'd send us a letter and say, geez, you spent $500, but that service that you received, or the service you received was worth $1,500, and you spent $400 because we negotiated so that's what you get towards your 7,500. And even though we had, by the time you get done, all it is they're keeping score. And one example I got is I needed to have a scan done, and I made arrangements in their system, in the healthcare system that we belonged to at the time, at the hospital, and they were going to, and I didn't realize how much it was going to cost. It was about $1,800 or something like that. An hour after I made the appointment to do that, I got a call on my work phone from the insurance company and said, you don't want to do that. You want to go get it done by this other company that does scans down in the strip mall down here, because it's all, and by the way, because it's going to cost you much less. And then so I followed their direction, and it was about $450, $500, something like that for the scan.
Right.
And when I'm getting ready to leave, they tell me, well, if you paid a day versus us billing you, we'll give you another 10% discount. And I'm going, okay, no problem. Here's my credit card, and I paid. But then I thought about it for a little while. I'm going, what in the world is our healthcare system doing? If I've got to go out and negotiate prices and take, I thought I should have asked them if they took Groupons or something, for care. You don't see that in the rest of the world.
Yeah, no. Well,
it's just a completely separate system. Well, I don't want to negotiate with my doctor how much my bill is going to be, or if I need a shot or something like that. I want him to give me the best health care that I can have.
Right, 100%. Well, and that's where, again, we're talking about trade-offs here, right?
Mm-hmm.
Everybody wants to make their money. So here's my story. I have a problem with my esophagus. Mm-hmm. For some reason, it locks up sometimes. And we were having ribeyes one night. Great ribeyes. I grilled them perfectly. Everything. Like Trump's. It's perfect. It's a perfect steak. Perfect steak.
Perfect steak.
And so I get a chunk of steak stuck in my throat, and I can't get it to go down. Yeah, so I have to go to the hospital, blah, 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 the whole thing. I went to one emergency room, and they couldn't fix it, so they had to send me to the big emergency room, and the guy had to come in and, expand my – and then I had to go in for another treatment. And what was interesting was I went in for the second – because they were expanding my esophagus, right? So it would stop doing that. I went in for the second expansion, and they said, do you have health insurance? And I said, no. And they said, okay, well, if you don't have health insurance, then they showed me the two lists. Mm-hmm. Here's how much it was if you had health insurance, and here's how much it was if you didn't have health insurance. Mm-hmm. And since I didn't have health insurance, it was like $15,000 if I had health insurance, and the health insurance was going to build, and it was like $6,000 if I didn't. So I'm like, what is this? This is ridiculous. Mm-hmm. This is not how it should be. Again, if I had the because the whole thing ended up cost, I went in debt about $20,000 over the whole thing, which mm-hmm. I'm paying off slowly. But if I had the catastrophic health insurance, no problem. Hey, you've been paying in, something happened, no problem. Boom, it's done. We paid the doctors the doctors, the nurses, everything they needed to get done. It's not an issue, right? And then maybe I needed to dip into my savings plan, no problem. Mm-hmm. That's the kind of insurance I need. Right. So if I get a piece of steak stuck in my throat, I don't have to go in debt $20,000.
Right.
But
the problem that whenever you ask the person on the street, what about insurance companies? Most of the stories you're going to hear, the ones I think I hear, are people that thought something should have been covered and it wasn't covered, and they had to dip in their pocket farther than their copays or farther than their, whatever their deductibles were and their copays. Because that's where I was, is every time we went to the doctor, it seemed like I paid more out of pocket than what I got credit toward my deductible, which mm-hmm. made my deductible, instead of $7,500, I was up around $10,000, by the time it was done. And with me, it didn't matter, but with my wife, it didn't So she was getting up there close to that number with stuff she had going on. And what happened was I paid in all the premiums and I don't get anything back. But you're not really supposed to get something back because the premiums are your peace of mind.
Mm-hmm.
Well, I got 2 more points for you real quick though. And people don't realize this, like if you work someplace and your employer, let's say that your total premium is about $1,200 a month. Your employer pays $1,000 or $1,000 of that, and you pay $200 out of your payroll deduction. Most people go, "Oh, I get cheap insurance. It's only $200." It's not.
Right.
It's really important that you look at your employer and say, "What's the total cost of insurance?" Because if he wasn't paying out that $1,000 a month, he should be paying it to you, right?
Yeah, 100%. Yeah. Well, and that's the thing is, so like with the company I'm with right now, if I were to buy health insurance, it would cost me about $30,000 a year for my family.
Right.
And, with a $10,000 deductible. So just never mind the deductible, but, why? Hey, I'm opting out of the insurance because I can't afford it.
Right.
Why isn't that $30,000 being incorporated back into my salary? And the reason is, part of it's because of the companies, but the main reason is because these insurance outfits want a pool. They got to have a pool of people.
That's right.
And so that's the thing is that's what I want to eliminate. I want to eliminate this kind of this, anarthrous health insurance for whatever it is. Hey, I want health insurance in case one of us gets a piece of steak stuck in their throat and they have to go to the hospital. Right. That's what I want health insurance for.